So welcome everybody. Good to see you. Good to see you. And yeah, I know it's a little late one right now. It's a little bit late of a live, but that's how the schedule goes. So we got to do what we got to do. And yeah, so we are here for all the questions that we got coming on. So today was a decent day. Pretty much I just came back from the gym, came back from working out. Today was a cardio day, so I did some skipping. I do interval training. So basically, I'll do like 2 minutes on and then 30 seconds rest, 2 minutes on, 30 seconds rest. And so today, I've been out of shape for a little bit, so I need to get back into it. I didn't have my jump rope. I was mainly walking for the past couple of months, but now I want to get into more cardio shape. So I was able to do 10 sets today before I got tired. So 10 sets of the 2 minutes on time and then with 30-second rest. So my goal is going to be to get to 15 sets over the next like month or so. So that's the plan here. So nice. All right, we got the chat coming in. Get me some. The desi food getting you out of shape. No, I don't really eat desi food, man. Like for example, when I was at my parents' house, I pretty much just had meat. I only ate meat, meat and veggies. So yeah, I've quit all the desi food. I don't eat rotis. I don't eat rice. I don't eat uh, mainly subjis even because that's just carbs. And we're trying to make gains here, and we're also trying to get summer ready. So those two things do not support that mission. So that's what I eat exactly. That's what you have to eat. That I think people don't understand nutrition that well, and our diets, quite frankly, are just filled with carbs. So yeah, but Rajma Chawal is bomb. Well, it depends on, what else is bomb? Going to the beach, taking off your shirt, and then everyone seeing your six-pack abs. That's bomb too. So it depends, what kind of bomb do you want? Do you want the gratification of now, or do you want the gratification of the future? That's what matters. Do you want instant gratification or delayed gratification? And the losers of the world choose instant gratification. The winners of the world choose delayed gratification. So you must decide which you want to be. But we are what we eat. Exactly, exactly. So yeah, that's just my view. This is the unhinged channel right now. It's 11:47. So this is where all the unhinged opportunities come out. Are you Gujarati? I am not. No, I'm Punjabi. Yeah, exactly, exactly. So, all right. Eleni's Elixirs says, I noticed redness on my rash and it's itchy. Is it lamictal rash? Lamictal rash is a lot more severe. Sometimes lamictal can cause mild rashes. So those are just something to be cognizant of. It's only like the severe ones where you say, okay, I need to stop now. So, yeah. What are the covers you have around your glasses? So these are for dry eyes, and pretty much yeah, they protect my eyes like this, so that way it helps with air coming in. So it's been a game changer. I was told on your chest is where the rash occurs first. uh no, not necessarily. It doesn't really depend on that. um Yeah, it could be anywhere. Chest is common, but it's not like unheard of. Thoughts on treating bipolar 1 without antipsychotics? Yeah, you can use mood stabilizers like lithium or Depakote. Amazing teeth, do you get them whitened? I do not, no, but I do use the Crest whitening strips once every 6 months. Also, brushing your teeth helps. Would you be willing to do a podcast? Possibly. We'll have to see if our audience is aligned. But yeah, if you're willing to like share your story on a long form podcast, yeah, I think that could be something that our audience could find valuable. So yeah, send me a message after and we can discuss it. Yeah. Does it make sense to repeat rTMS? Oh, rip. My light just died. So let's see. Okay, yes, that's why you always have a backup. So, what Sabrina asks, what are your thoughts on lithium? I mean, lithium is a good medication. It's called the gold standard, but it's got its problems. It's got side effects. So you got to know how to use it properly. What are your thoughts on Visceral every night? I mean, it's not ideal, but if it helps you sleep, then I think the sleep is more important. Visceral is also on the lighter end of things. Like, there's much worse medications to take for sleep. Should a psychologist be commenting on a client's medication? Probably not. That's always a pet peeve of mine when that happens. And the reason it's a pet peeve is because I've had patients come in and be like, "Oh, this medication is oh, my psychologist said, hey, I should change up my ADHD meds." So that's when it can, and if I disagree, then it creates like a conflict between me and that person. So that's usually the problem. Advice for someone applying to med school this cycle? I applied 10 years ago, bro. So it's like my advice is so outdated, but if I had to give you one piece of advice, I was actually thinking about this the other day. It was, so I've read med school applications, I've read residency applications, and basically and now that I'm learning really about personal branding, is to make sure all of your application has one story. Like there's one cohesive narrative that you're saying. So for example, when I applied to med school, my whole narrative was that, I was shy, unconfident kid, and then it became more social. I joined a fraternity, and then because of that, I became more interested in people. Before I wanted to do research, now I want to do medicine, so I can use that science to be more people connected, and therefore, I want to go into medicine. Like that was my whole story, and so all my experiences, like I put the ones that reflected that journey. I think the mistake that most people make is that they will just throw everything that they've done. But when you throw everything that you've done, it creates noise. It's way better to have one cohesive narrative and it all flows together than to have like a whole bunch of random stuff. Appreciate it. Yeah. What are the long-term effects on lithium? Kidney effects, heart rate, or kidney, heart issues, thyroid. Those are the top three areas that can get affected. It has some serious effects for sure. I remember I had this patient. She was a 20-year-old. Oh no, sorry, no. She was like a 45-year-old lady, but she'd been on lithium for 20 years, and I started asking her about the diagnosis for bipolar, and she didn't really fit the criteria. So I realized that she had actually wasn't bipolar, and so we could take her off lithium. She was more like BPD, borderline personality, but the problem was that so she'd been on lithium for 20 years, and it actually had messed up her thyroid, and so she had to get on Synthroid because of it. So that was very unfortunate that it had happened to her. So definitely, it's not an ideal. It's a good med if you're treating the right thing with it. Does Zyprexa weight gain? I mean, that's definitely a thing. Yes. Does it make sense to repeat rTMS when it worked but vanished after 1 month? I'm not sure what an rTMS is. Oh, you mean just TMS in general? Yeah. When it worked but vanished after. Yes. TMS, you have to do maintenance. TMS too. It's not just you do it then you stop. There's always a maintenance to it. Is triazolam ever really prescribed? I have one patient who's on triazolam, but not really. It's very rarely prescribed. Yeah, he's on it for sleep, but he's very resistant. Like he's a resistant patient. Thank you. That's great advice. Yes, of course. Welcome. This is where you're gonna get the top level advice. So this is the best psychiatric live you will come across. What things are missing in psychiatry training that need more focus? Integrative psychiatry for sure. Like I didn't learn anything about supplements and stuff and integrative lab work until after I graduated from residency. I came off Abilify 11 weeks ago. It's been a roller coaster. Doc prescribed me buspirone. Okay. Thoughts on Zopiclone and clonazepam together? I mean, that's definitely a lot. That's a lot of sedative stuff. I mean, if you need it, you need it. But I would say try to separate them if you can. Maybe the Zopiclone you take at night and Klonopin at the morning rather than everything else together. Is it possible to treat negative symptoms of schizophrenia? Yeah, you can use stimulants. You can use Wellbutrin. There's the newer antipsychotics like Caplyta and what's the other one? What's the other one? What's the newer one? Oh, Vraylar. So those have some evidence for negative ones too. All right, we will just get rid of you. Perfect. What college did you go to? I went to the University of Alabama at Birmingham. That was my college. Are gene site tests legit? They're okay. I don't think they're that good. I think they're overrated personally. I've been on a gene site rant before. Cobenfy. I think Cobenfy is super new. Yeah, I don't know too much about Cobenfy. I've never used it. It's like super, super new. I had a seizure on Wellbutrin, but I have no history of seizures. Yeah, Wellbutrin has some thoughts on causing seizures. It doesn't happen to everyone, but it can happen to some people. Can bipolar cause depression and paranoid thoughts mixed with OCD? Yeah, a lot of that stuff runs together. It definitely can. Yeah, bipolar. Because think about bipolar like it's like two spectrum. So you have bipolar, right? You got the manic phase, and then you got the depressive phase. Bipolar. So here, let me just draw. Yeah, I'm gonna do a little drawing here. So this is how bipolar looks like. So basically, you might have a euthymic for a while, and then oh, you're manic again, and then you're euthymic for a while, and then oh, you're depressed again, and then you come up here, oh, you're euthymic. So basically, it goes in these discrete phases, and so there's a depressed phase that can happen with bipolar as well too. Everyone should be on Lamictal. Well, I wouldn't say everyone should be on it, but it is good. Yes, it is very good for long-term care, long-term mood stabilization. Do you think magnesium helps with anxiety? Yeah, I prescribe it all the time, actually. I have a lot of patients that tell them, hey, go on magnesium. How do you cope with withdrawal if you've been on Xanax for 10 years? You just have to come off it slowly. One way that I do it is I switch over to a longer acting benzo. It's called Klonopin or Valium. So for example, I had a patient, I tapered her off of Xanax. Basically, she was on Xanax like 1 milligram a day. I direct switched her to Klonopin, and then we came off Klonopin, and that was easier for her than coming off the Xanax. Do you work in CA? I do not work in CA and take preceptor students. Yeah, so the only preceptor request that I consider is from members of my coaching academy. So I run a coaching academy for nurse practitioners. So basically teaching them psychiatry, because I had a lot of people come to me and they were like, hey, I feel like I didn't learn psychiatry well. No one taught me. My school is pretty shit. I don't feel confident. And so when I'm prescribing and practicing, and I was like, wow, this is a problem. And then, yeah, so I created the academy, and we've had over 120 students join. So it's definitely picking up. It's definitely growing in the past 2 months, too. So basically, my goal is to really help teach you psychiatry and to help you learn it from a psychiatrist, the level that you should have been taught in school, but you weren't. And that's, quite frankly, a problem with the education system, because they're just stealing your money, basically. That's what they are doing. So, but yeah, to answer your question is yes, I consider those requests from my students in my academy, and that's something I'm going to be building out too. Yeah, exactly. So the best way to do that is to hear. Let me look through. Yeah, you can just send me a message on that. Thoughts on ECT? Thoughts on ECT? It's good. ECT is definitely good if you can do it and if you can stick with it. Basically, it requires 9 to 12 treatments, and it can cause memory loss, but we do consider it one of the best treatments for depression, bipolar, and even catatonia, if you're able to stick through it. It also needs anesthesia as well, too, so it's not like TMS where you can just show up and like leave after. Dixaucin or Adderall, Adderall for sure. Cure for anhedonia, basically reducing the amount of dopamine you get, so that way regular stuff is more pleasurable to you. We overfry our dopamine receptors, thus decreasing the pleasure we get from day-to-day things. I work as a psych coach for patients prescribing psych meds. Nice. My friend Dr. Yosef was on recently, so check out that podcast we did together. It's on my account. Lamictal for paranoia. It's not used for paranoia, no. It's used for MCAT's tips. MCAT's tips, LOL. I took the MCAT over 10 years ago, and I took the old MCAT, so my advice is irrelevant. Thoughts on PSSD? Yes, so you have commented here before, and you recognize this. So if you want to know about PSSD, I'll tell you again. Check out my podcast with Dr. Yosef on YouTube, and you can see we have uploaded a clip as well on PSSD, but you can also check out the YouTube for the full discussion. He will tell us a lot more about it. Do you know Dr. Zafar from Huntsville? I do not know. I do not. Are you single? I am married to work in the game. Thoughts on Lexapro? Lexapro is great. I think of Lexapro like a starting antidepressant. Like basically it's like a start one that anyone can go to. What's the magnesium for? Magnesium for anxiety, depression, anxiety, sleep. So I take magnesium at night too, magnesium glycinate to help. Do you give SNRI with SSRI meds? No. You don't want to stack those two together. Which magnesium? How much? So magnesium glycinate. I like 200 to 400 milligrams. If you want to check out my TikTok showcase, you can see it on my bio, and then you can actually see where the TikTok showcases as well. So you can see like all the supplements that I recommend. So you can see it right on my bio. Me and Yosef share a lot of clients. Dr. Yosef interviewer. Nice. Yes. So check out that interview I did with him literally like 4 or 5 days ago. What's your say on L-theanine for focus? So L-theanine doesn't directly help with focus. It more like calms things down. But the reason it's used is because some people who are really just hyperactive and they can't focus due to that reason, then it can be calming. But for a lot of ADHD people, or just like the average person, we need more stimulation to be focused. And so in that region, it's not helpful for those people. And so you notice that L-theanine is often paired with caffeine pills. For example, my caffeine pills have L-theanine in them. And it's because caffeine gives you that stimulation, but then L-theanine does the calming so you don't get the jitters. Non-habit forming sleep meds, so magnesium's good. Hydroxyzine is good. It's not non-habit forming. Doxepin is non-habit forming. Trazodone is not habit forming. I don't like melatonin personally. I think it's overrated, and the tolerance builds very quickly to it. But that's my opinion. Sertraline. Oh yeah, sertraline can be used too for sleep as well. But the problem with sertraline is that the weight gain, so I don't like to use it unless like the patient is has some mood issues too. Which non-stimulant do you prescribe for ADHD with heart disease? I mean, there's only a couple options that you can go to. So heart disease does not mean that you can't use it, right? It just means you need to be careful. So I think one of our students asked this in a coaching call the other day, like, you can even use stimulants if there's heart disease, as long as you check the EKG and, you make sure that the vitals are good. Like, you can still use it. You just have to be cautious, right? Something I tell my students a lot is that there's a difference between, like, textbook psychiatry and real-life psychiatry. In textbook psychiatry, like, oh, no, we can't mix, for example, 2 antipsychotics together. Or, no, we can't use ADHD meds. We can't use stimulants with bipolar because it could precipitate mania. That's textbook psychiatry. Real-life psychiatry is like, well, patients who have bipolar probably also a lot of them have ADHD too. So you don't just neglect the ADHD. You make sure that both are treated. And the way that you treat both, right? You want to give the bipolar mood stabilizer. And then once you do the mood stabilizer, then you can use the stimulant on it. So similarly in this case, you can definitely use still non-stimulants or stimulants for ADHD. If there's heart disease going on, you just need to be careful about it and weigh out the benefits and risks. But if for non-stimulants, there's only two options, right? If you want something stimulating, you can either do guanfacine or not guanfacine, Strattera or Quellbri. Those are the only two options, really. And so, yeah, you could pick any of them. Those all have norepinephrine. And then if you want to address more of the hyperactivity side of things, then you use guanfacine or clonidine. How long does it take for a proper diagnosis, in your opinion? It takes a full psychiatric evaluation, I think. So I think this is another problem with psych evals, is most of them are too short. So if you go to like a standard psych, especially like a one who has a lot of insurance clients, then they're probably going to do or a busy practice, they'll probably do like a 45-minute evaluation with you. That one can be a lot, or too short, sorry. So that's why, like, for my evaluation, so I do 90 minutes because I found that 90 minutes has been the sweet spot to really do a thorough assessment and do a proper diagnosis and treatment. And that's with like getting information beforehand too. So 90 minutes to 120 minutes, I think, is the sweet spot to do that. So that's why I've had clients stick with me, because they're like, hey, I felt like I got really good thorough evaluation, where I felt like I was actually listened to compared to other places. So if that kind of care interests you, you can look at booking a consult in my bio too. So that's the best way to do it. Or here, you can just send me a message as well, and yeah, if that interests you, because most psychiatrist visits are just too short, and I think that it's really hard to make a diagnosis and good treatment plan and develop good rapport with the patient in just 45 minutes. So I think that 90 minutes is the sweet spot. Yeah, but exactly. And I think seeing my doctor for a year for a few visits has been the best help with meds. Yeah. So it's not like you can magically just decide what the whole treatment plan's gonna be the first time. You get started on the treatment plan, and then you go from there. So for example, I had a patient today, he's got a lot of severe anxiety, and so we switched around his medication plan a little bit today because he wasn't happy with his previous provider. Because I see a lot of people for second opinions and things because they're just not happy with their current care. And then, the next couple sessions we're going to work on his lab work and the supplements, but basically it's going to be step by step and not just everything all at once, right? So it's like a relationship that you develop with your doctor, and then you work together to address the issues. Yeah, so all the information's in my bio, Veronica. Delusional disorder, what do you know about it? Yeah, so I remember one case I had. This was a 55-year-old gentleman, and so he lived in a trailer park, and so I'll tell you why that's relevant. And basically, him and his wife lived there, so they were in really close proximity together. And he said that the wife was always trying to poison him. He said that she would. One time he came home and there was friends over, and he said that the friends were plotting against his poisoning. One time, I think someone's had parked a car or something outside the trailer. He said they were washing them so that way they could poison them. One time he went to the drive-through and they got food, but he said, oh, I think it's the wife's friend, and so he didn't eat the food because he thought it was being poisoned. And he's like, yeah, because my wife wants to steal my money, and like something like that. And so it was very, very, like, he was always stuck on this. He was always fixated on this, right? And so I prescribed him Abilify to help with his mood, but it's also an antipsychotic, so I was hopeful that it would help with those delusions too. Next month, he comes back, doesn't say a single thing about his wife. So I was like, wow, that was a delusional disorder case, and that one always stood with me. Okay, yeah, we got 158 people here. The questions are popping. They are popping. So yeah, if you want me to answer your question, best way to do that is to sub, especially if you want me to prioritize it, because there's so many going through that it's hard for me to stick with it. So that's why, yeah, you got to just keep going. Yeah, that's why subbing would really help. So that way it literally tells me that it's been subbed. So for example, Sheena has subbed, so I literally get a notification that, oh yeah, like Sheena is commenting. Should I take my Seroquel? I mean, I'm not your doctor, so I think you should discuss it with your provider. Like, I don't know the situations of it. Why are there any why are there so many side effects of Seroquel? It's because it hits a bunch of receptors, so it's got a bunch of benefits, like, you know, helps with sleep and mood and stuff, but then it also hits a bunch of receptors like the histamine receptor, so that's why there's like the weight side effects. But the nice thing about Seroquel is it doesn't have a lot of the muscle contraction side effects that some of the other ones do. So that's a big advantage of Seroquel. I feel like not enough people talk about. It doesn't give like the contraction issues that the other antipsychotics do. What else can help schizophrenia? Started the 3750 fish oil. Nice. That's a solid dose. Good for you. Basically just stuff to help your brain. So fish oil is good. Magnesium is good as well. Making sure you're getting good solid sleep. Basically all the stuff to help your brain. Solid sleep. Make sure you keto diet. That would be the next thing. If you could do one intervention for schizophrenia, it would be keto diet. Just get rid of those trash carbs and clean up your diet. That will clean out your brain more than anything else. Lex, awesome. Thank you for the sub. It did for me the last time, but I don't need Seroquel anymore. Do you hear a lot about akathisia with Latuda? No, not really. I hear akathisia is mainly common with Abilify and Rexulti. Why did you choose this field? Yeah, so basically when I was in high school, there was this girl I wanted to ask out to prom, but I was too scared to ask her. And so because I was too scared, some other guy asked her out and she said yes. And so I remember going to prom and I'm sitting there literally at the prom table watching this girl that I liked, because I went by myself, dance with this girl who I wanted to go with. And I remember just like having this tunnel vision in my head where I was like, you know, where you see like two futures ahead of you, and like one future was like, okay, I'm gonna be like this, and the other future was like, yeah, I saw the future where I was gonna be like that, and I was like, fuck that, like I don't want to live life like this. And so I went to college, put in a lot more effort to be social. Like I was like, me and a friend would like knock on different doors and like say hi and introduce ourselves, like in our dorm. I joined a fraternity, and so that got me exposed to like non-nerdy guys and girls and parties and like social campus events like happening every week. So I did that for 4 years, all of college, and then by the time I left college, I was a completely different person, and you know, like a lot more social and confident and stuff. And so then when I went to med school, I wanted to help other people make that mental change that I made myself, like that mental change, not just like physical changes. And so that's what led me to Psych. What's your opinion on risperidone? Yeah, risperidone's good. I like risperidone a lot. It's one of my favorites. Only for like pure psychosis. It's not really good for mood stuff. Have you noticed a change when you did keto? Yeah, I mean, it's really good. Okay, there's a lot of evidence for keto for bipolar, for schizophrenia, I mean, seizure disorders where the primary evidence comes from, and then that's where the bipolar data gets extrapolated. I had this patient, like a late 20s female, and so she has bipolar 2, and so I was talking about, okay, well, she was having some like hypomanic episodes that were causing destruction in relationships, and so I was like, okay, well, you know, we could start medication, but she was really hesitant on weight gain. So we said, okay, you know, we could do it naturally too, but we need to, one, avoid alcohol, and second, get on a keto diet. So she's like, okay, does the keto for a month, and then next month she's like, I'm good. Like, I don't feel depressed at all anymore. So, yeah, exactly. Meats, fruits and veggies, Greek. Oh, I love Greek yogurt. Yeah, Greek yogurt's amazing. Do you know Kamal, Arthan, and Irving? No, I'm from Canada. I live in New York. I wouldn't know that person. Do you treat teens? I do, yes. I'm a child, adolescent, and adult psychiatrist. Opinion on Lamictal? Yeah, Lamictal's great. Lamictal is definitely good. I use it for bipolar depression mainly. That's the main thing that I'll use it for. ongoing symptoms from PCOS, missing periods for a long time, 6 months, ongoing symptoms from PCOS, missing. Okay, so what's the question? Yeah, see, I'm like just like trying to repeat it in my head. Like that's why I got lost. I'm trying to study, motivate me. All right. Well, think about what it is that you want to accomplish. Are you going to accomplish that by watching doom scrolling on TikTok? Boom. I don't know who the Muffin Man is. Is that some reference? No. What to do for agoraphobia? I mean, meds you can do SSRIs or I mean benzos if it's really severe, but really you have to get exposure, right? Basically, it's like imagine that if you're scared of heights, you have to go to the first floor, then you have to go to the second floor, then you have to go to the third floor, then you have to go to the fourth floor, then you have to go to the fifth floor, etc., right? You kind of like move up from floor to floor to floor, and that's how you get comfortable with each floor. So, that's the same thing with agoraphobia too, right? Like first you might go to the driveway, then you go to the mailbox, and you might go to the next block, and then you work it up from there. Difference between Invega and oh, this light's really bright. Have a great night. Yes, you too. You too. I requested rip. Light just fell. I requested. Oh, rip! I already lost the question. Yeah. So consider subscribing if you definitely want me to prioritize your question, because like I literally just like they're all just flowing and I lose them. Back 3, I'm proud of you. Thank you. Is Psych a rewarding career? It can be if it's the right fit for you. But some people consider surgery a rewarding career. But I wouldn't want to be a surgeon. So it all just depends, right? Do you feel Abilify and nortriptyline are safe for pregnancy? Abilify, yes. I would not use nortriptyline. TCA is a little bit more risky. Opinion on non-stims added to stims for adult inattentive ADHD. Opinion on non-stims added to stims. Yeah, that's fine. You can do that. You just have to be cognizant, but I would try to maximize the stimulants first as much as you can. That's the main goal that you want. Why keto diet? Because there's a lot of evidence behind the keto diet. There's evidence for bipolar disorder. There's evidence for schizophrenia. And there's evidence for seizure disorders. So carbs are also known to be highly inflammatory, especially the simple carbs that most Americans eat. I'm not talking about vegetables. I'm talking about muffins, pastas, rice, cakes, that stuff that everyone eats, flour. And that stuff is known to cause inflammation. And a big cause of psychiatric illness is inflammation. And so that's something I teach a lot of my students too. So I'm developing an integrative module in my program as well. And something I want to really cover is inflammation, because I think inflammation is a huge cause of psychiatric illness. And that's something I'm shifting in my patients too, to assess how to assess for inflammation and how to treat inflammation, what labs to assess for inflammation, and what treatments you can use for inflammatory conditions too. I've had a lot of success treating patients with the right supplements like omega-3s and stuff like low dose naltrexone to really address some inflammatory stuff. So if you're a provider who really wants to learn a lot of integrative psychiatry as well, right? You're a PMHNP who wants to learn that, then definitely look at joining a program, because it really will be the best psychiatric education program there is. That is the goal. I requested higher Vyvanse dose. NP said this would require a monthly urinalysis. Is that standard? Not standard unless you have history of dependence on substances before. Depends on your practice environment too. A community mental health is different. How old? Guess. Do you have a hobby? Yes, working. You fidget a lot? No, I don't have ADHD. I don't think I fidget that much. Danielle says patient history TBI and acute psychosis with intense delusions. Patient not responding to antipsychotic, then what? I mean, depends on what the antipsychotic is, depends on what dose you're at. Sometimes I think people will feel like they're not responding, but when, and in fact, they might just need to be on it for longer, or they might need a dosage increase. So those two factors are very important as well, too. And so that's something we also do in our program, is that we go through my student will post a case that they're having, and then we'll literally go through, okay, these are the meds they're taking, what changes do I recommend, is diagnosis correct, what dosages do I recommend, that type of thing, because it really can help having a good case consultation with someone who is qualified, right? Because I run into something a lot of my students told me is that their preceptors or their collaborating psychs, like, they barely do anything and they're not accessible. So you're kind of at a loss, or it's really disservice that the education system has done to you. How's psych for work-life balance? I mean, it's good, but I'm the wrong person to ask because I think work and life are the same thing. So yeah. But it's also different. It's different when you work for yourself versus working for an employee. For an employer, it's like it feels like a grind. But I could work like all day, all day, every day for myself. Like right now, it's what 12. It's 12:20 p.m. right now. I got up around 10 a.m. So yeah, I've been working. Today's my heavy clinical day, so I've literally just been working all day. I ate, did some jump rope, and other than that, that's it. But it's fun for me. My whole life philosophy is that life is a video game, and so why waste time trying to level up in a video game? And I love games, but why waste time trying to grind in a video game when I could level up in real life? Thoughts on saffron? It's good for mild depression. Wait, oh my God, you're so young. I think I just look young. Your wife must love this perspective. Nope, that's why I'm married to the game. That's all that matters. What field would you pick if not OC psychiatry? Probably neurology or family medicine, but I wouldn't be happy with those. I would probably, if I had to do anything, for example, surgical, I'd rather just quit medicine. What is in psychiatry residency that is not taught in PMHP? I mean, like 4 years, right? So it's like in-depth psychiatry. So we do inpatient rotations, outpatient, like a whole year of outpatient, not just like 3,000 hours. The difference is like 1,000 or a couple hundred hours versus 10,000 hours, right? You become the team leader, so we get leadership. So you become the leader of all the teams. You understand therapy, so all the different types of therapies that there are, how to conduct them, and more appropriately, how to refer to them as well too. Those are the main things. And then I think the most important thing, quite frankly, is just supervision. So you get 4 years of direct attending supervision, and that's the way you really learn psychiatry. You don't learn it from books. You don't learn it from reading. You don't learn it from even like you can learn some of it from cases, but it's really doing cases and then having a mentor over you to correct. If you just it's like if you practice basketball but you don't have a coach, you could be doing the wrong shit and then no one would correct you. Versus if you have a coach analyzing every shot that you've taken, you are gonna skyrocket astronomically. So that's the biggest difference. For example, I had a couple psych NPs on my podcast 2 days ago. So I'll be uploading clips on that. You can also check it out on YouTube. But essentially, they were saying that, yeah, like our education is not standardized. Some of us got really good education, while others got really poor education. So, and I think it's a shame. I think that the schools are just robbing and taking your money and taking advantage of you quite frankly. And so that's why a lot of people have joined my program, because they're like, yeah, I wasn't prepared and confident at all, because the school is just quite frankly taking our money. And my preceptor doesn't do anything. And so that was the whole reason that I created it. What is your advice to a psychiatry resident? It depends. Like advice on what? There's so much to get advice on. Basically, my advice would be to learn everything. That would be the main thing. Try to learn as much as you can, and ask your attendings for learning as much as you can too. Really try to understand the medications, the psychopharm. Like that's what people are going to be looking to your expertise for. Have you worked at an inpatient mental health facility? Yeah, I've worked in a lot of inpatient mental health. Yeah, we had a lot of experience in that in residency. I also do part-time work at a prison too, so I got some experience with that. You are Beck 3, 25, 30. No, I'm 31, about to turn 32 this year. What do you think of Lyrica? I don't really prescribe Lyrica that much. I use more. I mean, it's okay for like a little bit of if there's anxiety or some chronic pain, but it's not something that I frequently prescribe. Neurologist I worked with use NAC for behavioral issues in kids. Yeah, I use NAC all the time, especially for OCD. It's my favorite thing for OCD. Opinion on clinical psychologist prescribing psych meds. I disagree with it. It's you're gonna cause a very bad issues with patients if you don't understand medicine. Invega, it is a medication, correct. Do you think ADHD is over or underdiagnosed? I think it's shifting in the overdiagnosis right now, but the pendulum will shift. Are there special glasses? Yeah, these are dry eye glasses. NAC for OCD. Yeah, basically NAC it's a supplement. It's called N-acetylcysteine, and it's used for OCD. Well, it's evidence that it treats OCD. Basically, it helps modulate this thing called glutamate, and oftentimes, a lot of time in OCD, glutamate gets sky high, and that's why people get like glutamate's an excitatory neurotransmitter. So that's why people get these repetitive thoughts over and over again, and so NAC will help decrease that. Like that's what it does. It modulates like glutamate. I'm doing my clinical psych PhD. I agree. Yeah, exactly. Just like I wouldn't try to do like complex neuropsychological testing. Like that's not my domain. That's why there's different fields. What do you like for excoriation disorder in older patients with dementia? I would do OCD treatments like SSRIs. Hey doc, I saw a huge fight happen an hour ago. It feels like it dissociated. Yeah, that's definitely a trauma response too. So I would say definitely do some calming things that you can. Do you think autism is over or underdiagnosed? I think it's under. I don't think we've reached the critical threshold yet. What do you know about F&D? Yeah, basically F&D is a thing about where, for example, I have a patient who has these episodes of FND, and basically he'll stop moving, his legs will give out. He also has these chronic pains, and they're always tied to like school-related stress. And so I've seen it mostly in the teenagers too. FND stands for functional neurologic disorder. Basically, it's like when people's nerves give out, they can't walk, or they have chronic pain, or they might have seizures, like we call them pseudo seizures or non-epileptic seizures. And basically, it's like when psychological distress causes physical neurologic symptoms. So you got to treat the underlying psychological distress. All right, Heavenly Lifestyle, thank you for the sub. How long does it take to reach full effect on Lamictal once hitting bipolar 200 milligrams? It should be pretty good by now. 200 is a solid dose. But it can take a few weeks. Is there a reliable way for patients to look up what OTC meds not to take with their psych meds? I mean, honestly, I would just ask AI. You can literally ask AI and it will tell you. I mean, obviously discuss it with your provider, of course, but like, just ask it. And for, because like all this stuff, like it's not rocket science. So, a med interaction is a very standard thing. It's not like it requires brain power to process that, right? It requires brain power to know it and to understand it and to apply it. But just to know from one med to one med, it's not a complex thing. It gets hard when there's a whole bunch of meds, and then you have to be like, oh, okay, well, some stuff can interact with each other. That's when it gets tough. Isn't NAC used for liver toxicity? Yes, it's used for complex liver stuff, yeah. Hi, Hino. Good to see you. What is a good supplement for depression or anxiety? You can use SAMe. You can use saffron. For anxiety, you could use magnesium. So check out my bio. I have a TikTok showcase there, and then you can see different supplements, especially ones I recommend. How do you think Invega works for schizophrenia usually? I mean, it's an antipsychotic, so it works well. I look up interactions and confirm with the pharmacist. Yeah. It blocks the dopamine receptor. I shake uncontrollably during high emotion situations. Yeah, that doesn't necessarily mean it's a FND though. That could just be a panic attack. Out of curiosity, do you work in tandem with clinical psychologists? I mean, I have some patients who are on clinical psychologists, who have clinical psychologists. Yeah, yeah, of course. What happens long term if you have ADHD but don't get treatment or meds for it? Pretty much you're gonna limit your potential. So imagine if you're someone who who has ADHD. So now, for example, I have a lawyer patient, and she took meds in high school, or sorry, in law school, and then she stopped for like 5 or 6 years, and then she started again. And so she told me that, wow, I went from taking my meds, from doing my work until 8 or 9 p.m. at night to now getting done by 3 p.m. And now I have the whole evening to myself because she was able to be way more efficient in her work. She also was ignoring a lot of her friends because she just thought it was overwhelming. And now she's like, yeah, I actually text my friends back and I meet to hang out with them because I want to. And because like I don't feel as overwhelmed anymore. So it really can just impact the quality of your life. Thoughts on ashwagandha? Awesome, Lex. Thank you for the sub. So, yeah, I like ashwagandha. It's really good for stress management and for cortisol decrease, for anxiety. Basically, I think of it like a stress absorber. But it takes time to work. It's not something you take immediately and it goes down, but it's also more like over time. Like, that's the main thing. It benefits over time. Are you watching the new Final Destination? I barely watch movies. The only thing I'm watching right now is The Last of Us Part 2 show. Can I take olanzapine and saffrons together? I mean, you can, but it's not advisable because that's two antipsychotics together. Thoughts on duloxetine? It's good. It's good for depression, anxiety with chronic pain. Teen son feels sad, hopeless, and defeated. Could this be clinical depression? Yeah, especially if there's hopelessness and defeat. So if you want to get assessment, definitely that would be the first thing to make sure you get him assessed, and that way you can get treatment too. So if you, for example, if you want to get a consult with me, the best way to do that would be in my bio. So you can if you want, you can send me a message, and then that way, I can send you a link, and then if you want me to assess them, or if you want a second opinion, the best way to do that would be to book a consult. Due to go to 91 on my schizophrenia paper I was telling you about. Nice, congratulations. There you go. It's meant to be. Psych NP. Do you have a favorite TV show or movie? Yeah, my favorite movie is La La Land. Favorite TV show? I don't really have a favorite. I used to really like Dexter back in the day, but then it went downhill. I mean, I guess I have a favorite anime though. My favorite anime is One Piece. Like that I'm sure of. But I don't have a favorite TV. I don't really have a favorite like standard TV show. I've never rewatched a TV show from my knowledge. Yeah. Can you grade it? No, I don't want to grade it. You do online? Yeah, I see all my patients telehealth. Base favorite anime? Yeah, it's so good. Let's go OP. Yes, yeah. I'm up to date too. I'm up to date on the manga. So like I know what's going on, and like I read all the theories and watch like I watch One Piece YouTubers and stuff. Like I love the lore of it. I love the world building. It really is. Oda is really creating incredible anime, and I thought the live action was really well done too. So nothing but praise about it. Obviously, it's got problems. Uh, like characters don't die, and the filler and anime in the anime pacing is atrocious. And there's a bit too much over dramatization of the characters' bodies. I think that's just the fan service is too much in my opinion. Um, but it's still a incredible anime. Are you happy with your career decision? Yeah, I am. Yeah, I am. I am. If I could go back in time, I probably wouldn't become a YouTuber. But yeah, I think we're making the most of it. Yeah. So Veronica, yeah, all the information's in my consult. So you just go to that page and you'll see all the information there. Hook your patients with One Piece. Yeah, I do have some patients who watch One Piece, and we always talk about it. So, One Piece. The biggest challenge with it is that everyone's like, "Oh, there's so many episodes. There's too many episodes." And so I had a buddy who was like that. He was like, "Oh, I can't watch One Piece. I could never watch One Piece." And then the live action comes out, and so he starts watching, and then I don't hear from him. The live action comes out, and then he sends me a Snapchat of one of the characters on the anime, and he's like, "Guess who started One Piece?" And I was like, "Yo, let's go! What happened?" And he's like, "Yeah, well, I started watching the live action. It was so good, I had to start the anime." So yeah, maybe you'll learn a thing or two from my paper. Possibly, possibly. You Is there a treatment for epilepsy? Yeah, the medications are literally called anti-epileptics. 9-year old doesn't like to sit down in class. 8 thinks she's ADHD. Yeah, but his grades are great. Yeah, ADHD. There's a hyperactive component too. You don't have to be sad or not function academically to have ADHD, right? It's attention hyperactivity disorder. And Vega or Abilify for schizophrenia. They're both similar. I mean, either works. They're both antipsychotics. Do you think medical school is worth it anymore? I was actually just thinking that. Like, I really don't think it is, quite honestly. Um, Doctor pay is not going up, it's going down. Med school loans are going through the roof. Doctor respect is going down. There's a lot more viable avenues for successful careers, especially with online marketing, social media, the internet, uh, content creation, all of that stuff is way too much. You can make way more money doing that than grinding for 10 years to become a doctor. So I think that the value in becoming a physician is going down, down, down. Yeah, and plus it's just different. So if when you're a doctor, you think like an employee, which is fine if you want to be an employee. I've always, not always, but especially in my last few years, I've always felt trapped in the career of medicine because it's so rigid. I have to be a good boy. I have to behave. I can't show how I am online, and I can't like express my personality fully because patients will judge me, or my colleagues will judge me, or providers will judge me, right? Or the field will judge me because it's a very conservative field. And it's only now that I'm becoming a lot more comfortable like this because I work for myself now. So I'm like, well, I don't have to work or cater to any employer. So, I don't have to make sure I don't say something that could get me fired, right? Because I literally work for myself. All the clients that I have, the patients I have, they come to me because they want me, right? They vibe with me, they feel like they like me, so I can be a lot more authentic. And the patients who don't want me, you can just keep scrolling. And the patients who like me and they like my style or my vibe or whatever, then they come and seek me out. So it's like a win-win either way. And yeah, so yeah, that's my little rant right here. Oh yeah, and you're in debt for so long too. Like literally, you're literally clawing in debt. So, in med school, I was 50 grand in debt per year, and that's cheap. So by the time I was 26 years old, I was $200,000 in debt, and I went to a state school in Alabama where the cost of living is low and the tuition is super low. Whereas if someone goes to a private school or a DO school in a income state or a high cost of living state, they could probably pay like 80 grand per year. So then they end up being in like what's 80 times 4, 80, 160, 320, 320K debt. And then they have to go through residency. And then residency is like, 3 to 5, 6 years where you get paid like 50, 60K, 70K, so that by the time you get out, you're like 31, 32, and you've given up your youth to become a physician. And you're way more in debt. You could barely pay off the med school debt. So then you become an attending, and so yeah, sure, you can pay off attending the debt when you're an attending because you're making six figures, but the debt has skyrocketed. Like the interest was ballooning, so now that 360K debt is probably like 450 now because the interest bloomed, and now you have to live like a resident again for the next couple of years to be able to pay off your debt, and that's assuming you're not starting a family, you're not buying a home, like doing those kind of expensive things. So it really is much less worth it too. And I'm a guy too. So now as a girl, you're literally sacrificing your 20s to get into do this medicine thing. So now, instead of going out enjoying your life and being social, especially not using like your youth, right? Is the time when you should be enjoying things. You should be like focusing on dating and stuff, right? Trying to find the best partner that you can. A lot of girls really feel burnt out. Like my sister's the same way. Like she's in podiatry residency right now. She works like 70, 80 hour weeks. She's like going on calls, and like she'll finish a hospital shift at 6 p.m., then be on call to like 6 a.m. the next day. It's like a 24-hour shift. And she's like, why the F did I ever do this field? Like, this is so dumb. I've literally wasted all my 20s. And by the time I graduate, like, yeah, I'm going to be a 30. And so, yeah, it's definitely, no, these are realities of medicine no one talks about. I don't know you, but you have great work ethic. Yeah, I love working. But I love working for myself, not working for other people. That is the difference, right? That's the difference here. It's so hard to own practice, right? See, those are skills you have to level up. The In medicine, when you enter medicine, the only skills you learn are how to be a doctor. You don't learn business, you don't learn marketing, you don't learn sales. These are all skills that I had to level up on my own to do that. You don't learn social media. Like, this isn't shit no one tells you, but this is stuff that I spent nights, weekends learning, so that way that could be here on a Thursday night vibing out with you. And that's the difference, is that imagine if I had learned all this stuff on my own without all the medicine to learn with it too. Then I could have been just as successful without all this extra time spent on medicine. But, that's the path I went down. So I had to stick with this path and then do what I could. So now I'm using the extra entrepreneurial skill set, that mind and whatever, those kind of fun things, and then combining it with medicine. So the nice thing about this is that now there's way less competition. So for example, if I wanted to be a fitness like coach or some shit, then okay, there's like a million different fitness influencers and a million different fitness people. So I would not stand out in that field. But now there's not that many psychiatrists online. So therefore now I'm happy with it now because the competition that I face in this business entrepreneurial journey is way less than the competition of, let's say, being a fitness person, a fitness influencer, right? Which is sky high. So that's the advantage of that. And then the way to be successful is that you have to combine skills. So it's not like you have, so like medicine is a skill, right? And then marketing is a skill. Then social media is a skill. Then speaking well is a skill. And then charisma is a skill. And then, looking good, trying to look best is a skill. And then organizing your background, whatever, that's a skill. So basically, you have to be successful, you just have to stack all these skills together. And like success will compound. So it's kind of like this, it's like this, and then over time, and then all of a sudden, it's like, ooh, it goes up like that. But there's always that, you hear that thing, it's like the iceberg thing, right? Where it's like that you see the overnight success, but then you don't see all the iceberg of effort that they put underneath. So it's like, if you have an iceberg and then you have the water, right? So the iceberg is the iceberg is literally like this, but all you see is like the success over here. So yeah, that's my my rant. Yeah, night, bro. I didn't start med school till 29. Yeah, exactly. And I started at 21, 22-ish. So I owe 500K my homes. Yeah, exactly. See, this is the stuff that no one tells you about medicine, and it's not the ideal career, for sure. It may have been like a couple years ago, or not a couple years ago, like a couple decades ago, right, when there wasn't an internet. But now with the internet, the game has shifted. This is so funny. I never expected to get into this discussion. I had a patient today who she's an entrepreneur, and so I spent we talked about medicine and stuff, but we spent we had an hour because we do like medicine therapy coaching together, and the last session we literally just talked about business the last half an hour, and gave her business advice and business coaching. That was super excited and super pumped to do that. Random question, but is that your hair? I mean, it is here, yes. Today is Wednesday. Yes, today is Wednesday. Agreed. Yeah. I'm telling you, this is the unhinged chat right now. This is 12:30, 12:46 on what is it, fucking Wednesday, Thursday? Yeah, this is the unhinged chat. This would not be happening early in the morning, but this is right now. So, you got to do what you got to do. Psychiatrists or MDs, yes. So random, but you have nice skin. 9 hours of sleep every night. That's what will do that. Law only taught me the law, nothing else. Right. So that's why it's called law school, right? And it's the same thing in real life. And this is the metaphor that I live, is that life is like a video game. So just like in a video game, you have what are called skill trees. And in a skill tree, basically, you might have attack skill tree, you might have a defense skill tree, you might have a stealth skill tree. So for example, here's your attack skill tree, here's your defense skill tree, here's your stealth skill tree, here is your technology skill tree, like your item skill tree, here's your dexterity skill tree. And as you level up these skills, that's how you get better and better in things in the game. Oh yeah, like charisma, right? So there's different skill trees that you have different stats. Now, real life is the same way. You might have your physical skill tree, you might have your mental health skill tree, you might have your career skill tree, you might have your your clothing skill tree, your charisma skill tree, right? You might have your relationship skill tree, and you might have your friends skill tree, family skill tree. There's all different skill trees that you have, but you can level them up so that way you get better and better at that. And then the more that you can level up, the higher and higher level bosses you can challenge, and the more complex things that you can do. Does Lexapro have side effects? It can, yeah. Some people have side effects from it, yeah, like nausea, GI side effects, diarrhea. Usually it can go away though. Did you choose your residency, or you lucked out with psychology? So the residency match is a different way. It's not like you get to choose it. Basically, you apply for a bunch of positions at the end of your fourth year, and then some of them, and they also and then you rank them, and then they ever rank you, and then you just kind of go together. Basically, it's like a match. It's literally called the match. It's based off of the OkCupid match algorithm. I shit you not, the way that doctors get matched together is based off of a dating app algorithm. And then what happens is that you submit your ranking of the match list of your programs, and then the programs will submit their ranking of candidates, and then they'll put them all in a big algorithm, and then they'll see how people match. That's literally how it happens. How do you treat binge eating? You can use metformin, GLP-1 agonists, Vyvanse. I have a patient with autism who we started, he's on Vyvanse already, and then we started metformin, and then I'm going to add in we were trying to get the GLP-1 agonist approved for him, but insurance is giving us problems. But yeah. I've tried numerous antidepressants, but none seem to work. My baseline is meh. Thoughts? I mean, that's where I would recommend getting a consult, right? Like that way you can actually work with someone and like get your physical situation assessed. Because like if you tell me antidepressants don't work, there could be so many reasons for that. You could be bipolar. Your dose could have been crap. You could have not tried it long enough. The diagnosis could be something else, right? There's so many reasons. There could have been other life stressors. It could be interacting with your meds. It could be lab problems. Like there's so many reasons. So that's why I would recommend getting a consult. So the best way to do that is in my bio. Veronica, awesome. Thank you for the sub. Appreciate it. Psych versus NP in psych setting. Yes, so check out my interview I did with two psych NPs named Elizabeth and Lindsay. So it's on YouTube. That's where you can check out. I'll be posting clips of it over the next like week or so. But you can check out the full interview in YouTube. You can just search my name and my channel is there, and literally you can see the entire discussion on that topic. How do you treat binge eating with metformin? Yeah, metformin can help the cravings. Also can help some of the weight gain too. I like to start with Vyvanse though for it. What labs would you run on someone with panic disorder? I mean, depression, anxiety, integrative labs like magnesium, zinc, A1C, B12, folate, homocysteine, methylmalonic acid. So basically the way I do labs, and I actually explained this yesterday in my coaching program too, but basically I have a standard panel, which is like A1C, and here, I'll just show you. Actually, I think my computer might be dying. Whatever. So basically I do A1C and like standard, it's called a standard integrated panel, where I check a lot of like zinc, magnesium, thyroid stuff, like basic electrolytes and all that. And then I also do infectious testing for some patients who want deeper workup. And so, for example, I had this one patient who she had panic disorder, agoraphobia, and we did infection testing. And so she had previous mono, she had previous mono, she had previous herpes, she had previous there's one more, mono, herpes, I forget the third one, but there's not some other CMV. So she had 3 different infections that she'd had history of. And so I'm like, yeah, now you're super inflamed, like literally you have all these antibodies floating around trying to treat this inflammation that's going on. So I put her on an anti-inflammatory protocol, and I think that inflammation was causing a lot of her symptoms. Yeah, infectious testing, yes. And so that's something so this is what we call integrative psychiatry. So standard psychiatry only teaches us, like depression, anxiety, like schizophrenia, like just like med treatments for that. Then you get what's called integrative psychiatry, and that integrates a lot more, holistic health, supplements, lifestyle changes, functional medicine stuff like the infectious testing, mold testing, Lyme testing, that kind of thing, because that all that brain health testing, because all that stuff can contribute to mental health issues. And so that's something I teach in my program as well. So if you're a PMHNP who really wants to learn a lot more about integrative psychiatry, right, not just standard psychiatry, then definitely look at joining us. Yes, you choose how to get your life. So your life is your own books and chapters. Yes, exactly. You choose how you want to live your life, right? You choose the mindset you see the world with. I have learned so much about myself tonight. Thank you. Do you precept PMHP students? So that's something I'm looking at implementing in the future about precepting and collaborating. But the best way to do that is to join our program, because I'm only going to be doing it for students in my program, because they're the people I want to serve, right? And quite frankly, they're the ones that I trust too. because I get to work with them, I get to learn about them, and I get to see and help out their clinical skills. Like literally, I discuss cases and stuff with my students to help them. Do you have any tips on USMLE Step 1 dedicated? Uh, I took Step 1 like 7 years ago. So, wow, that sounds crazy to say. Yeah, I took it in 2017. So I'm sure my tips are outdated by now. New PMHP here. How do we register? Yes, the best way to do that is to um, you can send me a message and I can send you a link, or you can just check out my bio. That's the best way. Just check out my link. Yes. So it's all just send me a message. I can send you a link, or it's in my bio. But yeah, thank you for staying. We've been live for 70 minutes, so I think now is a good time to call it. So if you are a PMHNP and you want to learn from me, right? You're tired of, you feel like your program didn't teach you, you really want to build confidence in psychiatric skills, you want to learn from me, board certified psychiatrist, child and adolescent psychiatrist. You have preceptors who don't really teach, or you have collaborators who don't really teach, right? And you just want to become the best provider that you can for yourself and for your patients, then you are the kind of person that we want in our program. So and you want to do it without feeling lost and confused, right? Because I know what that feels like. I remember in residency, they literally just threw us in third year and they're like, okay, have fun, take care of all these 100 patients now by yourself, good luck. And I was like, we barely learned anything. How do we do this? And so it's like a sink or swim mentality. And so that's not the proper way to really learn good in-depth psychiatry. You need mentorship. So like that's what I want to offer to you. So if that's you, right, you really want to learn, then definitely look at joining our program. If you're a patient and you want to get treatment with me, then definitely just look at booking a consult, and you can do that in my bio as well, or just send me a message here. Otherwise, it's been a pleasure, and I shall